Hi guys, my name is Dan, I'm a veterinarian, and today, the ear hematoma in a doggy. What is an ear hematoma? Why does it happen? How does a veterinarian fix it? These are so weird, but your dog's ear is huge right now. An ear hematoma is a fluid-filled pocket of the pinna. The pinna is a part of the ear. We call it a hematoma because it looks like there's a bunch of blood in it, but usually it's just a bunch of fluid collection. The ear, or the pinna on the dog, is that triangle-like part of the dog's ear. And when a dog's ear swells with blood or fluid, we call it an ear hematoma. And when you touch it, it's soft, it's warm, and the dog keeps shaking their head because it's uncomfortable. Now, an ear hematoma can happen for a handful of reasons, but usually it happens from an underlying cause, like an ear infection, or allergies, or anything that causes that doggy to shake their head a lot. Veterinarians will approach this differently no matter where you go. And there's no right or wrong answer. It's all about what's the best for your doggy, for you, and getting that ear feeling better. Some veterinarians will do medical management. They may do a steroid orally to reduce inflammation. They also may poke the ear and drain it and then infuse it with a needle with more steroids into the actual ear. The thought is, if we can reduce the swelling, the inflammation, the ear will hopefully help it to drain and not be an ear hematoma anymore. This is a slower process to have it go away. This has been shown to work well in some cases. And the second option is surgery. Now, if medical management with the steroids doesn't work so hot, don't stress, we can still do surgery. Or if you walk in and the ear is huge and the veterinarian's like, oh my gosh, let's fix that right now. Surgery is when you have a big ear hematoma and the veterinarians make a cut in it and they're going to drain it all out. And no joke, guys, it drains out beautifully. It's just like a waterfall of warm, serosanguinous, bloody fluid. And when it's all out, the veterinarian's going to tack it down with some suture. The way you should think about it is they leave that cut open and they just tack it down with suture so it can't fill anymore. Because if it's tacked down and you have a cut in it, it can drain out. Also, it can't refill because it's sutured down. This helps the ear to heal smoothly and flat and as quickly as possible. Yes, you will have a scar in that ear where the incision was made. And the ear may even be a little bit scarred down in certain areas where the sutures are. No matter if you do medical management with steroids, either orally or injections into the ear, or if you do surgery where they make a little cut and drain the ear out and then suture it down, you will, in most cases, have some scar tissue. Because there's just so much swelling and the ear is so beat up from the ear hematoma, no matter how good your veterinarian is, a little bit of scar tissue is very common and should always be expected. The major goal is to prevent them from happening again, is treating the underlying cause. If you're like, Dan, Dr. Dan, we're always shaking our head because of allergies, treat those allergies. If we have repeat ear infections, get ahead of them. Treat the underlying problem so we're not shaking our head and causing trauma and causing ear hematomas to form again. Guys, thank you for watching. Hope this was super informative about ear hematomas and how I treat them and what you're going to notice. If you like this content, like and subscribe. I would greatly appreciate it. Please comment below. Tell me a little bit about your doggy. That'd be great. Take care.